Nigeria has a population of over 200 million people, with Nigeria's gross domestic product projected at $504 billion approximately. Nigeria is ranked 31st largest world economy in terms of nominal GDP, the largest in Africa, the 27th largest in terms of purchasing power parity, although with a decline in a recent past. Nigeria, with its vibrant cultural legacy, diverse ethnicities, natural beauty, vast population, remains Africa's wealthiest country and the continent's top producer in terms of GDP output, with finance, transport infrastructure, tourism, abundant crude oil being major contributors to the country's GDP. The number of Nigerians living in poverty rose by 35 million in 2022. The country's inflation rate increased by 21% in 2022 compared to an average of 10.6% for emerging and developing economies and 8.8% for the world. The percentage of unemployed is 32.1%, and the external debt from Nigeria is $85.9 billion. This magnitude of economic hardship could present further risk to Nigeria's security and national health of individuals. The Nigerian political aspirants have officially commenced their electoral campaigns for the 2023 presidential elections and are top gear for voting polls on the 25th of February 2023. There is no better time than now within this political transition to remind political leaders and the entire society that government, policy, and your voting can influence health equity and outcomes. We all should be reminded that health is as critical to our nation's development as the economy, infrastructure, security, manufacturing, agriculture, and other priority issues. As such, health must take its strategic position of prominence in the political discourse. There is a direct connection with how our government works, how it influences policy systems, community structures, and how that impedes or impacts health outcomes. Health financing is a major determinant of people's health. Maternal mortality, under 5 mortality, low contraceptive use, malnutrition, amongst others, are related to economic development. Hence, if health financing is done rightly, it will improve human capital, which will consequently improve national socio-economic and political development. Research has shown that Africans have a higher prevalence and poorer outcomes from heart diseases than other Western countries, not majorly attributable to genes. But the common denominator for Africans, especially Nigerian Africans, to have a higher prevalence of cardiovascular disease and poorer heart outcomes is not the fact that we are blacks or Africans, but it can be attributable to the following. 1. Late detection on account of lack of infrastructure, poor access to primary health care systems, lack of access to standard or state-of-the-art health care delivery, poor road networks and transportation services for emergency situations. Number 2, brain drain and exodus of qualified, experienced medical doctors and healthcare workers in search for greener pastures due to the poor salaries of healthcare workers, hence less access of the masses to quality healthcare. Thirdly, the lower socioeconomic environment with increased poverty and malnutrition, environmental hazards such as air pollution with exposure to nuclear plants, water pollution with improper waste disposal into natural water sources or reserves, and poor sewage disposal. Healthcare providers have to question the health policies and how it influences health equity and health outcomes. As clinicians, we have a voice and we have the collective power to ask for a change. We all should vote for a government that will enable the aggressive upgrade of health infrastructure in Nigeria. A government that will increase investment in political infrastructure. Technology should be encouraged to drive efficient service delivery, data aggregation, and computerization of health service delivery, as well as develop a framework for joint financing of infrastructural projects between the tiers of government. We should vote for a government that will encourage private investment in infrastructure, that is, public private partnership sector investment, harnessed to improve healthcare systems. We should argue for responsible financing and allocation of resources appropriately. We therefore encourage all Nigerian Africans to come out and vote en masse for change. We have the collective power to say yes to a new order of government, to say yes to a better healthcare system we desire for our generation and those yet unborn. Let us vote wisely, and our vote is our desired change. Barack Obama said something. Yes, we can. And surely, yes, we can. Thanks so much for listening.